on the overall project objectives and sort of where we're at in the timeline, and also offer some discussion prompts to help shape the conversation, but then we will start accepting comments after that. We can move to the next slide. The overall purpose of the evaluation is to develop a system for establishing and maintaining rates that are sufficient to sustain the providers while ensuring main care members have access to high quality services. It's also to evaluate main care's rates in the rate setting system to develop a plan for creating a comprehensive, streamlined, and coherent system moving forward. I did want to reiterate, because there was some confusion, this is not actually a rate study of individual rates. We're not recommending that rates be adjusted as part of this. This is just a presentation of comparison states and what this rate is in other states. Go ahead and move to the next slide. So we had initial provider listing sessions in October, member listing sessions in November, and this is our second round of provider listing sessions in December. In November, we released the cataloging and benchmarking report right before Thanksgiving. And in January and February, we will be releasing interim findings and then a final report with recommendations on a process and structure, a priority list, for looking at rates and a comparison of payment methodologies across states. For today's meeting, the rules of engagement, sort of the meeting structure. It's our role to keep participants to have their comments within announced time limits. This is a smaller meeting, so I'm not going to say 5 minutes and then I cut you off. But if it's going to be much longer, we do want everybody to be able to speak. And so if we kind of wave you down and ask you to wrap it up, if we have time at the end, I'll reopen it back up for more comments, but we just ask that people respect each other and give everyone an opportunity to speak. And also to ensure that the comments pertain to the topic under discussion. Your role, prior to commenting, if you could introduce yourself, your organization, and the services you provide, that helps us to associate your feedback to the right services. If someone before you has said the points that you wanted to make, you can agree with them and then not run through the list again. And then again, just please respect each other and any time limits for being able to give a comment. The purpose of today's meeting is really to gather those additional points that are important for consideration regarding rate comparisons, recognizing that the numbers alone don't tell the story, and then also to get feedback on the sufficiency of your current rates and any issues related to those rates and their impact on access or sustainability. And to that end, we have a couple of discussion prompts to sort of help frame the conversation a little bit. Are there assumptions or costs that are critical to consider that may be unique to Maine that wouldn't be reflected in another state's rate? Are there differences in payment methodology that may explain some of the differences in certain rates, though it may not be evident by just looking at the fee schedule and service descriptions? And are there services where current rates contribute to access or quality issues, and do these issues then impact other parts of the service system? So with that, I'm going to invite you to please go ahead and raise your hand if you would like to speak, or chat to us in the chat box if you can't find the little hand symbol, and Jillian will unmute you.
Okay, thank you. First up, I have Nathan Miller.
Hi, my name is Nathan Miller, Senior Program Director for Spectrum Generations, and I am here to comment on Section 19 as well as Section 96, both sections for which Spectrum Generations provides personal support services. In yesterday's call, I spoke to Section 13. I highlighted costs and expenses that are unique to Maine. I won't repeat that list, but it is also relevant here. To illustrate Maine's unique costs, though, I did find the wage for North Carolina's home health aides. North Carolina Health News reported the 2016 median rate was $9.30 per hour, so far below our median wage and well below our minimum wage. I was curious how North Carolina managed direct services at such low rates, even considering they operate in a lower cost economic environment. And what I found is that North Carolina is not a state we want to use as a model. A 2017 home care market assessment in North Carolina reported only one paid caregiver for every 10 home care clients. With their rate structures, it appears as though rural areas in North Carolina are drastically underserved across the continuum of healthcare services. So if Maine wants to have viable services, we need to have viable reimbursement rates. Thinking local and current and relevant, Home Care for Maine closed this year, a decision they made before the pandemic. They cited at the time increasing financial challenges, new government mandates, a shortage of home health workers, and low Maine Care reimbursement rates. So what you're hearing at these stakeholder meetings is real, and if there aren't changes made, more agencies will go out of business and more consumers will be left without services. My suggestion is to analyze our local market and tailor amenable rates that value our consumers, that value our workers, and rates that will help direct service agencies grow, because we are Maine's community healthcare infrastructure. Thank you for holding these stakeholder forums and for undertaking this important work.
Thank you, Nathan. Next up, I have Jillian Jolliker.
Good afternoon. My name is Jillian Jolliker, and I'm the Chief Operations Officer at Assistance Plus, and I was a long-term care workforce commission member. I'm here to discuss concerns for Section 19 and 96 nursing and personal support. The current rate for both sections of policy is not sufficient for T1019 and G0299. Low wages cause issues with concerns for recruiting and offering competitive benefits for both PSS and nursing. Over the last 10 years, we have seen significant declines in approvals for clients that need higher level care of a certified nurse's assistant. This means members with higher needs are being pushed into our personal support services, but lack the appropriate funding for their higher level care needs. Reimbursement should really be provided by levels of care and not one quarterly billing rate. This program has long wait lists of over 10,000 hours that were reported during my commission's work. It also has access issues. These issues were all addressed during the Workforce Commission last year. The work for the commission prioritized starting wages for our field staff to be 125% above that of minimum wage. Currently, our organization has not been able to meet that goal due to the limited funding that we received from MaineCare, and the coronavirus has put that bill on hold. I do want to point out and be thankful for MaineCare for the increased reimbursement that our service for personal support did receive during 2020. It has helped us keep our doors open. RNs have an associate's or a bachelor's degree and should be reimbursed competitively like those rates for children's case management or adult case management. Those rates for nursing remain critically low. Over the last few years, nursing reimbursement was supposed to include flat visit rates for intermittent nursing house-to-house visits, an average visit being 1 to 1.5 hours. Currently, only Section 19 has offered a published rate, which my organization to date has not been able to bill. It is my understanding that CMS has also been working on a flat rate for Section 96 intermittent nursing visits. However, that also has not been approved. Addressing this is of great concern in 2021. There are few agencies left doing this intermittent type nursing that we do here. Due to critical funding issues, this service really needs a high prioritization in 2021. I have spent nearly 6 years addressing the reimbursement concern for nursing. This service would benefit from an inside look on how we pay organizations with a push towards value-based purchasing. The provided benchmarking report for PSS shows that Maine is already paying more for this service than other benchmark states. This program has significant overhead here in Maine, and despite the increased funding in 2020, this program remains in the red. I suspect the benchmark state's reimbursement is lower due to lower minimum wage than our state's upcoming 1215, with a known plan of the intent for healthcare workers to start at 125% once our bill is finalized. This will make Maine one of few states in the entire United States that will actually show value for our home care workers by giving them their own minimum wage. Thank you.
Thank you, Jillian. Next up, I have Lori Belden.
Hi, good afternoon. Thank you for this opportunity to speak. Just to honor your request earlier, ditto, both for Mr. Miller and Jillian Jolicoeur. I think they are hitting the right points. One thing that Nate referenced was in a call yesterday, he talked about those components that are unique to the state of Maine. I just for the record and for the conversation today, that would include the upcoming pay time off that is not reflected in Maine care rates that are provided. Oh, I'm sorry. This is Lori Belden. I'm the executive director for the Home Care and Hospice Alliance of Maine. And we are a member organization who represent Medicare certified providers across the state, as well as state licensed and registered. I apologize for not doing that first. So our members are seeing budgets shrinking due to state mandates that are being implemented now, including electronic visit verification, the cost of implementing the technology for that, the state of Maine minimum wage increase, as well as some are being affected by the Portland's increase as well, which again are not part of Maine Care's reimbursement system at the time. And again, the pay time off that's going to be starting in the coming calendar year. So all those rates are not being, Maine Care is not keeping pace with those other additions to the costs of providing care across the state. Thank you.
Thank you, Lori. Okay, I am not currently seeing any more raised hands or anything in the chat.
So again, if just wanted to open it up because this it's a pretty small meeting. If you would like to speak now or again, if you have already spoken, please don't hesitate to raise your hand or chat to us in the chat box so that we can unmute you. We did put the email up. If you would prefer just to submit something to us in writing, that's fine too. The rate setting eval at maine.gov. I am not seeing anyone.
Okay, I've got a few things in comments here. First up, I've got Colleen Hilton.
Oh, can you hear me now?
Yes, we can.
Okay. Colleen Hilton, I serve as the president for Northern Light Home Care and Hospice, and we do cover and span pretty much from the Canadian border to southern Maine. I primarily wanted to address section 40, if it's okay, and that is our desire that the rate setting actually mirror Medicare rates, because they are revisited annually by MedPAC, and it would be a great simplification, quite frankly, for all of us that deal with government payers. The complexity of reimbursement is just continually changing based on commercial insurance, government payers. If we could at least keep Maine Care in sync with Medicare, that would be most appreciated.
Thank you, Colleen. Next, I have Jillian Jolicoeur again.
I just wanted to point out, I mentioned it during my last, when I was speaking there, but I just wanted to point out when we're looking at addressing what an efficient rate would be for personal support, that we reflect on the work of the Workforce Commission, because so much of this work has already been done with a very a very distinct set of guidelines of what the commission would like to see as an outcome, you know, whether it be training, how rates are proactive and how frequently we look at them, to how agencies are compensated for mandates like EVV. We built that all into a timeline. And I just want to make sure that, because if you're basing it on previous years or other states, that Maine was really unique in doing this type of commission, and the work that was done inside it was really detailed. And I just want to make sure that we're reflecting on that when we're looking at the rates.
Okay, thank you, Jillian. Yeah, and that's okay. I'm not seeing any additional requests to speak in the chat or with hands. There are a couple comments in the chat that we will be saving and recording.
Okay, great. Well, then I think everyone can go and enjoy the rest of your lunch. We really appreciate the time you took to come and speak to us today and to give us your feedback. And if you think of something later you would like to tell us, please don't hesitate to send it to the email. Thank you again, everyone.
Thank you.